About 3 to 5% of the population reportedly suffers from chronic diarrhea. Today, let's review the top causes, what tests doctors typically do for it, and when you should worry about it. Everything and anything that I'd want my own patients to know. Unlike your watery poop, you don't want to miss this. If it's your first time here, I'm Dr. Maj. Consider subscribing to this channel for up-to-date medical topics and headlines. Note that diarrhea is defined as a persistent change in stool consistency, ranging from anything from loose to watery stools. And for some, it can be every day, while for others, it can come and go, but it's still frequent enough to impair their quality of life. Let's review some of the most common causes. Here we go. Number 1, medication side effects. Antibiotics. Antibiotics kill bacteria, and this sometimes includes the good bacteria in our gut that is maintaining that equilibrium that keeps our stomach and intestines in check. Therefore, antibiotics sometimes interferes with this harmonious balance and causes diarrhea. Hence, it should be limited to true bacterial infections, such as for urinary tract infections or bacterial pneumonias, and etc. Now, true or false quiz for you guys. Is sinusitis, or inflammation of our sinuses, most often caused by bacteria? False, you guessed it. You know this was coming. Metformin. This is a very commonly used first-line generic medication used to treat diabetes and sometimes prediabetes and polycystic ovarian syndrome, or PCOS. Its gastrointestinal side effects sometimes limits its use in some people, as it can cause diarrhea and abdominal discomfort, and even more so if taken without food, by the way. However, the side effects do tend to go away in most people, typically within a few weeks after initiation as the body adapts to it. Anti-inflammatories. Now, ibuprofen, Advil, Motrin, Aleve are all examples of non-steroidal anti-inflammatories, or NSAIDs we call them. They can irritate the stomach lining, and diarrhea is also a reported side effect as a result. For those who are sensitive to its effects, acetaminophen, which is Tylenol, may be an option, as it is not an NSAID. Magnesium products. Numerous over-the-counter medications contain magnesium, including milk of magnesia and Mylanta, used to treat indigestion, certain laxatives and supplements, including some of those that contain calcium. Diarrhea is one of its most commonly reported side effects of these magnesium-containing products. Yep. Number 2, irritable bowel syndrome. Now, by far, one of the top causes of chronic intermittent diarrhea is IBS, or irritable bowel. I've covered this topic in much greater detail in a recent video, so I won't reinvent the wheel in today's video, but these patients tend to experience constipation, diarrhea, or both, and almost always have some type of abdominal discomfort on and off throughout their lives associated with it. There is often a mental health component, but not always, such as things like stress, anxiety, and depression, which are common triggers of the symptoms, as are certain foods. Number 3, infection. Now, most cases of infectious diarrhea are not bacterial, they're actually viral, and they tend to resolve on their own without any treatment. But here are the top causes of non-viral infectious diarrhea, which tends to be more severe than viral diarrhea, and they also tend to be more acute and not necessarily chronic. But here we go. Clostridium difficile, or C. diff we call it. This is a bacteria that can overgrow in our GI system when given the opportunity, and antibiotic use is again the most common culprit, and it does this by destroying the good bacteria, allowing C. diff to overgrow and set up shop in your intestines. People that are immune compromised can actually more easily contract it, such as elderly patients or hospitalized patients, or those on chemo, or those on medications used to treat certain autoimmune disorders such as rheumatoid arthritis and psoriasis. In addition, there are reports that certain medications that suppress stomach acid secretion can interestingly also predispose patients to C. diff. And there are many people who routinely take this group of drugs as it is readily available over the counter. These include examples such as omeprazole, pantoprazole, famotidine, and ranitidine. Other bacteria, Campylobacter, Salmonella, and Shigella, are examples of other bacterial infections of the gut that can cause diarrhea. It is less common in the United States and more prevalent in those who have had recent international travel. However, occasional reported outbreaks have occurred with contaminated things like vegetables, meat, poultry, eggs, unpasteurized milk in the United States, and can also spread more quickly in day centers and nursing homes. Parasites, protozoa, including Giardia and Cryptosporidium, are parasitic GI infections that are typically either food or waterborne. It is again less common in the US, are more prevalent in those who have international travel, but there have been reported outbreaks in those who consume water sources while hiking and camping in the US, in addition to daycare centers and public swimming pools. Number 4, medical conditions. First of all, celiac disease. Celiac is a hereditary autoimmune condition, which means that the body erroneously regards certain part of itself as foreign and mounts an immune attack. In celiac, it is often in response to the ingestion of gluten, which inflames the small intestine and results in diarrhea. And it is more commonly in those with European descent, but also increasingly found in those from India, northern China, and the Middle East as well. Note that gluten intolerance is not the same thing as true celiac disease. Those with intolerance don't mount an immune-mediated response, but just simply fare better without gluten in their diet. The theory is that it may be due to a simultaneous absence of fructans, which often accompany foods in higher gluten. Inflammatory bowel disease, not IBS, but IBD. Crohn's and ulcerative colitis are the two IBD subsets and often have a genetic component and tend to run in families. These people tend to begin experiencing symptoms like earlier in life though, like I would say teens, 20s, 30s. And they may also have other accompanying symptoms such as fever and joint pain and mouth ulcers and unexplained eye redness. They also tend to report more bloody diarrhea, although not always. Hyperthyroidism. Although not too common, a hyperactive thyroid can also trigger diarrhea in some people. The condition can also cause elevated heart rates, palpitations, increased anxiety. Everything seems to be revved up, including your GI system. There also tends to be a genetic component, as it is often hereditary, and a simple blood test can screen for this. And lastly, number 5, dietary causes. Food intolerances can also cause chronic diarrhea. Now, not everyone's the same. However, our tolerance limit of a specific food may be different. For instance, like you may tolerate a little bit of milk in your cereal, but an entire cup of milk may just drive you to the nearest toilet. But here are some of the more common culprits. Sugar substitutes. This includes things like diet sodas, sugar-free sweets, and sugar substitutes that are added to your coffee. Lactase. Again, this includes anything that has cow's dairy in it, including milk, ice cream, cheese, yogurt. Caffeine. Because besides the obvious coffee though, you don't want to forget tea, chocolate, and sodas. And lastly, alcohol. Sorry. When should you worry about chronic diarrhea? Well, most chronic diarrhea is benign and self-resolving. However, the following red flag features make it more concerning and you should be aware of them. Severe diarrhea, unintentional weight loss, family history of inflammatory bowel disease like Crohn's or ulcerative colitis, family history of celiac disease or family history of colon cancer, bloody stools or black stools, and severe abdominal pain. If you're experiencing any of these features, make sure to see your doctor right away. Now, if the diarrhea is persistent, recurrent, or bothersome in any way, then your doctor may initiate a workup to discover the cause. Now, here are some of the tests that may help shed light on your symptoms. A CBC. This will be helpful to determine if there's an accompanied anemia, which can be present in those with like celiac disease or those with bleeding in the stool, even if it's microscopic and you can't see it. A TSH. This is to rule out for hyperthyroidism. Electrolytes, because if the diarrhea is significant, then it can sometimes cause electrolyte imbalances. A celiac panel. This would help rule out celiac disease as long as there's not been any gluten restriction in the diet, which can actually mask the results and yield a false negative. Stool studies. They can screen for bacterial causes, including C. diff, and also for ova and parasites. If there's a question of possible blood in the stool, a stool test for blood may also be useful. A colonoscopy. Now, depending on the symptoms and other workup results, and of course your history, your doctor may consider a referral to gastroenterologist for a possible colonoscopy, which is a camera scope that is placed through the rectum and into the colon to view the lining of the inside of the colon. Now, if you found the information valuable, which is always my goal, please give it a like and hit that red subscribe button along with that notification bell next to it so that you don't miss any of my future videos. And please feel free to share it with someone else who may find it useful. Now, thanks for tuning in. Wishing you well-formed stools and great health until next time.